older the individual, the less is the flexibility and more is the chances of these things happening. We feel that we've cutting down the mileage, but what has the internal muscle fiber also got its resting length is important.
Even these external supports to support the ankle, even after the taper phase, then those will be helpful rather than not having them while running.
That's where the whole idea of compression socks came in, where you could actually pump the blood and not get things out.
Over the years, doctor, with experience, we have also seen that compression is also very important for the size as well.
Someone who only wants the advantages of compression
Correct.
as part of your circulation, calf compression alone is adequate. Yes, the whole foot compression will give you added benefit of stability around the ankle. It's a big Pandora's box, not even a small one. If you're someone who has a deformity, you need to accommodate that. You need that special corrective gadget in the shoe which will take care of that, so that you don't end up in our clinics more frequently than anywhere else. Having a flat foot is not a problem. Having a flat foot with pain is a problem. The commonest thing that gets me a lot of patient is barefoot or minimalistic runnings. One celebrity able to do that doesn't mean that all of us can do that.
Welcome everybody to yet another webinar by Sorgen Wellness Strides. And today here we have with us here Dr. Abhishek Kini, who is a foot and ankle surgeon. Thank you so much, doctor, for joining us. And a little about Dr. Kini. Dr. Kini is a leading DNB orthopedic surgeon, and he's a diploma holder in sports medicine as well from the International Olympic Committee. He is a foot and ankle reconstruction and sports injury specialist. His inputs will really be helpful for everybody. And he has experience of over 15 years of including advanced fellowship training across UK, Europe, and Asia. He heads the Foot Arc Clinic, practices across leading global hospitals in Mumbai, and is also a part of the renowned orthopedic center, Advanced Orthopedics. And he is widely trusted by runners and athletes for his precise practical approach to foot and ankle injuries, recovery, and long-term performance. Today, Dr. Kini will help us understand how runners can better manage foot and ankle stress, fatigue, and recovery to keep running much stronger and for even longer. And I would just like to add something here. Dr. Kini is also an avid cyclist. Am I right, Dr. Kini?
Yes, I also run. So
you run. Great. So you will be the best person to guide our surgeon community here. Thank you for joining us, doctor.
Most welcome. Thank you for having me. My pleasure.
Yes, doctor. So we'll dive into, we have a set of questions that a lot of people have asked us to ask you. So we'll start off with those questions. And then we have a lot of questions in the chat box as well.
Correct.
Right? So we'll begin with the few questions that we've been asked to ask you, and we'll begin with those. So, doctor, for runners who are already feeling tightness or heaviness in their feet and ankles before the start of the race itself, how should they approach the race? Are there any specific warm-ups, mobility drills, or last-minute tips that you'd like to recommend to our running community?
So I think calf tightness could be two reasons. One is it's coming from above somewhere, like your whole posterior chain being tight. Like if you have a bad core, bad back, bad tight hamstring, that can also lead you to tight calves and plantar fascias and other things. Second, it could be due to plain overuse of your calf, where your mileage has suddenly increased, where the calf has been firing continuously and has not got enough time to rest or recover out of those lactic acids have not been washed out. So those two things. So you have to first maybe get it like just introspect and see what has gone wrong, because at this time of the year, so close to the event, I wouldn't suggest going too much deep into it, but just look into your mileage, keep things simple, and I think you will get an answer. Try simple things at home. If it is the calf tightness, see where you can go, see if something new has come in, where has gone, whether it is one-sided or two-sided. and listen to your body. I think most of the times if you just listen, hear, and feel, you will have a good clue to what you're ending up with, and I think that will be your go to solution, maybe 10 days before the event. I don't think you should over diagnose or overthink about things right now.
Right. Okay. That's a good suggestion to listen to your body and go with how you feel, basically. Right. Runners often complain that their ankles start to wobble, leading to instability once they're tired, or they experience a sharp stretching pain at the bottom arch of the ankle. What can cause this actually, and how should one respond if you experience this kind of a pain mid-race?
Okay, so those are two complete different problems. Again, one, the instability of your ankle mid race. Someone who's doing say like a 42 or a 21. And say like a mid mileage, if you get the wobbliness, so that's a sign. So let us go back and understand the ankle. So ankle stability has three components. One is the bony stability, where the bones are articulating properly. Then the bones are held together by ligaments. Again, those are ligaments which are static stabilizers. And third is your dynamic stabilizers, which are your muscles. The muscle fatigue is causing this wobbliness. You need to take a break. You need to stretch, get your lactic acid washed out, things settle down, get your cramps if you're getting any cramps. One group of muscle cramping can cause other groups to be unstable, those things to settle down, and things will be fine for you. So that is one part about your wobbliness. The second problem that you complain of, mid race getting a bad pull or a stretch in your mid arch area on the sole side. So that is your plantar fascia or plantar group of muscles which are cramped because of your tight shoes, because of your mileage, because of multiple things that are there. So these are like there are almost 42 muscles in your feet which are actually working in synchrony to bring about this event of running or locomotion. And that too in a high mileage, someone whose cadence is high will get this quite often. It happens to me also. So most often this will be, again, you need to take out your shoe, see how tight or loose it is. If you have to stretch your plantar fascia, if you're in any of your physio stations nearby, roll your feet on your small foam rollers, get your calf and plantar fascia stretches done. So again, these are your plantar muscles being tight or stretched beyond the elastic capacity of your plantar muscles. So those two things that you asked, ma'am, were two different things. One is
Right.
your ankle and one is your midfoot. So one could be external due to foot shoe wear or something, and ankle stability could be because of your muscle fatigues of your peroneal tendons and other structures around.
Right, doctor. So it is very important to have the stretch, pause when you feel a pain, and
Correct.
stretch and not push it through at that point in time. So
Absolutely.
any kind of pain is a sign to pause and check where the pain is coming from and how you can address to it at that moment.
I think most guys who are listening to this would all be elite runners or could be serious runners. So, they will know what is a good pain and
Correct.
what is a not good pain. Normally most of us will get a intuition where this is not something good. You will
Mhm.
get that. This is
Right.
something that is more than the routine good pain that you have of muscle soreness or something like that.
Correct.
I think that should be fine. Nothing, well, that's what, again, it all boils down to on the race day, listen to yourself and listen to all the training that you've gone through, just visualization of all those things will be fine.
Correct. So, doctor, when runners push through late race foot or ankle discomfort, what determines whether that pain settles down after the race or turns into an injury actually?
Again, most of these are muscle tendon injuries or muscle tendon failure leading to other structural injuries. So when your muscle tendon junctions are fatigued and that causes certain structural overloads like joint overloads can cause cartilage
Mm.
injuries, ligament
Mm.
overloads can cause instabilities, or muscle tendon per se can also have tendon snaps or something like that. So basically, you have to, uh, you know, most of us will know beyond which you should not push someone who's especially. And again, one big component is your age and your recovery pattern in your age groups. So someone who is like an elite runner, younger the individual will have a better recovery potential than someone who's a recreational runner in his elderly age group. So all
Mhm.
those things, it's a combination of a lot of things that go into injury and recovery from injury. So a lot of things go together. So
Mhm.
red flags where things are serious are, at the end of the race, that once you stop, once your body has cooled down, your pain should start getting better. But once you've cooled down, and if you still the pain is there, once you
Right.
cool down and you still can't bear weight on that foot and ankle, once you have cooled down, once you still feel that the ankle is wobbly, or you feel apprehensive that I can't, cross the road, I can't go back into the cab, it is showing signs of inflammation like swelling, those are all red flag signs where you should not neglect them.
Correct. And doctor, we mentioned about plantar fasciitis and even Achilles tendonitis tightness, rather
Correct.
Achilles tightness. Usually, we've seen these flare up during the peak training phases, but it also happens during the taper phase of the training.
Correct.
So, we just wanted to understand what's happening in the body and why this happens, and do external supports, help athletes with recovery, performance.
So, uh, so it can the basic reason for them to happen is your tightness. So it's like if any of our sleeves of our shirt or anything is tight, and if you stretch your arm, wherever it is sewed, like in the shoulder region or near the cufflinks, will stretch and more likely tear, or rather more likely open up. The older the individual, the less is the flexibility and more is the chances of these things happening. It may not be a tear per se, but it could be a wear and tear also, which could
Right.
call it as a tendinosis, and a tear is a rupture. So tendinosis is the first step. Second step, where you start getting soreness and other things. In the taper phase also, what is happening is, because you have crossed that peak phase and you're in a phase where you're actually dropping your mileage, but still the muscle relaxation has not happened adequately. So
Correct.
that is the time where you need those deep tissue massages to release, get your muscle back to the resting length. We feel that we've cutting down the mileage, but what has the internal muscle fiber also got its resting length is important. So until the muscle gets its resting length, it is actually not resting, it is always in a contracted state, where the muscles are overlapping on each other.
Understood.
Till you get that resting length down, things are not going to settle down. So make sure that you get your in your uh, weaning off phase or in your taper down phase, make sure that you get your muscle length, get your relaxations and stretches and everything properly.
Right. So, even these external supports to support the ankle, even after the taper phase, then those will be helpful
Yeah,
rather than not having them while running.
absolutely, absolutely. So that's where the whole idea of compression socks came in, where you could actually pump the blood and not get things out.
Correct.
Then there are night splints that a lot of runners use. Then there are those recovery bags which you have pneumatic compression boots and everything.
Right. Right.
So the more, there is no end to gadgets, especially
Correct.
in today's world.
And since you mentioned a lot about the lactic acid buildup and
Correct.
a lot of pain, the lactic acid buildup is a factor. So that's where I think the role of compression socks and
Yes,
compression calf sleeves come in to
yes.
help reduce the lactic acid
So
buildup.
again, in fact, getting into them also needs to be gradually weaned in, because
Right.
that's also important. I've had patients who've worn it for the first time and directly run a
Correct.
long mileage, and come with compression neuropathies and other things. So you need to get used to them. uh,
Right.
I think it needs proper guidance, like do it with a good coach who understands your mileage and everything, and that is how it will happen.
Over the years, doctor, with experience, we have also seen that compression is it's very important for the size as well.
Absolutely. So that's why
And
you
the style, the
right?
size, the fit, everything is important for people to
Absolutely.
get used to. So we very particular on that. And doctor, since we are touching upon the topic of compression, and since we work very closely with sports compression and in this space of compression as a whole, one of the most common questions that we hear from runners is whether to choose the full length compression socks, which covers the toe, the heel, and the ankle, that covers the whole foot area basically, or whether they should go in for calf sleeves that focus only the pressure from the ankle to the calf. So full socks also provide compression around the ankle and they have an extra coverage on the foot area, which may improve the stability or reduce the injury risk as such. What is your take, doctor, and what is your opinion? And how should athletes decide whether they should wear the full or whether they should take the calf sleeves?
I think it's a very individual choice to be made, to be very
Hmm.
honest. Someone who only wants the advantages of compression
Correct.
as part of your circulation,
Hmm.
calf compression alone is adequate.
Okay.
But someone who wants wearing a calf compression alone
Hmm.
can also cause edema in the foot, can also lead to mid race circulatory disturbances in the feet and cause cramping and other things in your that same mid arch plantar side pain that you.
Right. Right. Right.
So that's why I think someone who is getting onto these compression sleeves,
Mm-hmm.
it's important that you try each one properly, see what works, see what works. Again, come back to your team, come back to your coach, come back, like just introspect. See, yes, the whole foot compression will give you added benefit of stability around the ankle, but again, do you need that? Do your foot and ankle needs it? Is one question. Because there are no freebies. Means if there it gives you something, it gives you a compression. So you should be comfortable carrying that compression for those 2 hours, 3 hours, 4 hours, 5 hours that you will be using
Correct.
body part vigorously.
Correct.
So,
Correct.
it's a very individual choice.
Right.
One comes with an advantage, and so is the disadvantage. So
Right.
that's why it's important that one does it properly.
Yes, so one has to adapt it probably to
Correct,
according to their requirement or their how they are comfortable with it.
correct,
Definitely, the ankle stability is an add-on and is a pro, but yes, having to wear the full sock as well, one has to get used to it and accustomed to it.
correct.
We've also seen, doctor, that post-race, people keep the compression on for recovery as it helps again further for the lactic, to reduce the lactic acid buildup. So for that reason, some people keep the calf compression because they can keep it on for a longer period after the race. So, as you rightly said, it's a very individual choice, and one has to wear and try and get used to and accustomed to what they prefer. Having spoken about socks, doctor, let's come to shoes. How important is the criteria of shoe selection for a runner with respect to foot and ankle issues? And why at sometimes people feel, oh, they have the perfect shoe and this is the best fit at the beginning. But once you start running later and you realize, oh, this was not as good as I thought it would be. So, your comments on this, doctor?
So again, it's a big Pandora's box, not even a small one.
Okay,
Uh, each one is individual and both are dynamic. Dynamic, what do I mean by dynamic? Means everything changes. Your foot also changes as per every kilometer mileage that you run.
I
And
see.
so is your footwear who's going to change because of the elasticity and the modulus and everything.
Mm-hmm.
So again, what type of a foot you have will determine what type of footwear you need. So someone who is really flat-footed, you would want, a certain amount of stability to come in. Now,
Mm-hmm.
someone who is like a rigid foot would need certain amount of cushioning to come in. So those
Mhm.
are again quite individualized. Again, most of us, as we run, we know and we see ourselves, we know what works better. I'm not
Mhm.
a big brand guy, but a fit is very important. Make sure that your fit is comfortable.
Mhm.
Make sure that as you run, every hour you run, there would be certain amount of gravity assisted pulling in the foot, which will make your shoe tighter as you run. So that's where you have to have a comfort fit to begin with, which as you run, even if it kind of expands, the shoe should also be able to expand and accommodate your the gravity assisted pulling that has happened,
Right.
and should able to hold and help you navigate through your runs comfortably. A
Mhm.
big debate will go on whether between minimalistic versus carbon grade
Yes.
versus this. So that's means we can talk on this a whole day. So again,
Right.
bottom line is it is individual. Listen again, see your foot. If you are someone who has a deformity, you need to accommodate that. You need that special corrective gadget in the shoe which will take care of that, so that you don't end up in our clinics more frequently than anywhere else. So
Correct.
we want you to have a injury free, pain free run that way you want it,
Mhm.
and
Mhm.
things should settle down for that.
Right. So is it good to get the foot assessed if you're, having frequent problems with your foot and ankle? So,
Yes, if you're having frequent problems, then yes, it is good to get it assessed.
okay.
But most of them may not have frequent problems. Once you kind of get your foot in a kind of footwear, there are basic two or three types. One would be really minimalistic, one would be like stability shoes, and one would be like a more cushioned with certain
Mhm.
like midfoot arches and everything. So
Right.
basic broad guidelines would be there would be certain shoes for your daily run, certain shoes for your you know uh, what you do, say like repeat certain gym shoes. So make sure that you don't interchange them, because certain loading patterns will also make them malleable in certain forces. So
Okay.
don't run in your gym shoes, run in your running shoes, because
All
they
right.
would have, you know, borne certain weight through that whole process, and they
Correct.
will help you do that in a better way.
Right. Understood. That's a very good pro tip, doctor, not to mix the gym shoes and the running shoes.
Correct.
Let's talk about pronation and supination, how these affect a runner's performance and what are the things they should take note of to run injury free.
Um, I honestly feel it's little extra blown up concept of pronation, and
Okay.
I think it's quite super marketed. I'm not saying it's not there.
Mm-hmm.
People who get those things on the shelf will
Mm-hmm.
say that this is the panacea for everything that is there in a runner's injury. But it's not like
I
having
see.
a flat foot is not a problem. Having
Okay.
a flat foot with pain is a problem. There are enough athletes who are flat footed,
Flat-footed. Okay.
whatever, pronated as they call them, and they have represented like their country and our country also to the highest level and got us tons of medals. So please don't fall for them. Again, going back on the same drawing board is that it should be most comfortable to you. If your foot has a deformity which is severe, like
Mm-hmm.
flat foot, and is rigid, means it's not flexible, it's not correcting, it is nature's way of telling you that, look, my friend, you are someone who's not designed to run. If you
Mm.
push yourself to run in that, you are going to cause more injuries to yourself or more pain to yourself.
Mm-hmm.
Don't get into that kind of a hassle or a tug of war with yourself. Listen and respect biology. Keep your mileages low. Do your halves. That should be good for you. But if you're really going with a bad flat foot and they come in our clinics and they say that they want to participate in an ultra next year, my mileage is not going up. I'm getting pain every time I cross the mileage. And you look at the feet, they are severely flat footed. And if I tell them that, boss, you're not designed to run it, they take it up like a big hit on their.
Right.
So don't do that. It's your way, it's your body's way of conserving your own thing. Means we are happy to treat you, but there's also a running injury free, or when you cross the finishing line,
Absolutely.
you
Absolutely.
should be happy, a big smile on your face, not wincing finishing line, right?
And not with pain, definitely.
Absolutely. So listen again, understand your body and your demands and then train accordingly.
So that's really important, doctor, because as you rightly said, there's no point in running with pain, and then you don't feel the joy of, the accomplishment as well if you have
Correct.
physical pain going on.
Correct.
So a lot of runners, doctor, they say that despite doing everything right, they still wake up next morning with stiff ankles and sore soles. What should runners focus in the first few hours of the race so that, they can support proper foot and ankle recovery and reduce the next day stiffness?
I think basically all these come down to your running patterns.
Mm-hmm.
Um, means I won't say you need to change something now. It's too late. But if you're getting frequent soreness and all, that means your muscle firing is not recovering to the way that it needs. That the rest is falling short of getting your recovery. Means your mileage is crossing high. So you need to rest more. You need to stretch more,
Mm-hmm.
and there are things where some people may need more rest than someone else. Someone can
Correct.
recover in like 6 hours of sleep, someone needs 8 hours of sleep.
Right, right.
Sleep is a very important component which most of us in an urban lifestyle don't
Mm-hmm.
pay attention to.
Mm-hmm. So again, as we come back to listen to your body, and it's individual for everybody how much
Yes,
rest they need, but the rest is a very big criteria for recovery, is what you're
absolutely.
saying. And what signs tell us that recovery is incomplete? You
I
know,
think this whole thing, soreness, not being fresh the morning, all those signs are very important sign. I
or
mean,
probably again frequent pains and frequent aches is
it
again.
could be a sign of a neglected injury also. But if you're talking about recovery, means
Right.
recovery is from your regular activities.
Okay.
Pains could be from your one-off injury also. Recovery is inadequate rest. Like that recovery
Right.
is rather soreness and all those things are, it's important. You need your sleep. Again,
Right.
very important thing is your nutrition. Your eating, your diet, all those things also are your building blocks. So your nutrition, your sleep, all those things are important for your recovery. And again, all these things can't happen in the last 2 months. Process. It's a good 6 to 9 month of process to get you to a good competitive uh,
I see.
podium finishing running level. So
Right.
need to work on this throughout the year. It's like a lifestyle.
Got it. And doctor, what is, according to you, the single best habit that runners can build for better foot and ankle health? And on the flip side, what is the worst habit, runners unknowingly adopt that slowly worsens the foot and ankle condition?
Uh, the best thing that I feel is, I think, religious stretches. I think is important, and I think cross training means uh, it's important to do good strength and conditioning. It's important to do cross training, like not only run but sometimes bike and swim. Those like hydro exercises and all. Those would be really good for your longevity as a runner. Uh,
I see.
Worst things would be, there are certain fads that come and go. Uh, the commonest thing that gets me a lot of patient is barefoot or minimalistic runnings,
Hmm.
because I think our roads are not meant for it primarily.
Correct. Correct.
Number two, our bodies in an urban scenario are not used to running that way. One celebrity able to do that doesn't mean that all of us can do that. So
True.
it's important that how he has trained and how he has done it is very different to our bodies.
Right.
So I think those would be the good ones is stretching and cross training. The bad ones is like stop following newer trends which are there in the running circuit.
Right. So to summarize, Doctor, on a closing note, what will be that one piece of advice for runners who want to keep running year after year? What recovery and support habits that matter for long-term foot and ankle health?
Um, I think foot and ankle primarily or can be secondarily affected. So your whole body needs to be in a good fit frame of mind and space. So write your running pattern, and it's a part of a biokinetic chain. So don't just look at foot and ankle, look at your core, hip, your girdles, your running pattern, which way, lot of things come. So it's a combination of everything. For you to run long, I think, as I just said, cross training helps people who have always been active, having a good muscle memory. Do your Nowadays, most runners do their good strength and conditioning, but I think flexibility and getting into the pool, getting a good hydro, getting a good cross training is important. Nutrition is extremely important. Make sure that you build your blocks properly, and sleep well. I think it's important.
Yes.
uh, Urban lifestyle sleep is extremely under valued asset.
Correct. 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 So, well, Doctor, thank you so much for your time. And these were the set of questions that, we had put together based on the questions we received
My
from our running community. But there are a lot of questions in the chat box. And Mr. Amit Das has asked his first question, and I'm going to request him to unmute and ask his question. Mr. Amit, you can
Yeah.
please, yeah, ask your question. Please go ahead.
Uh, Actually, I have a pronated legs feet actually. So how does this compression shocks will help me for running?
Uh, so pronated foot compression socks per se might not help you, because pronation is a change in your alignment at the joint level, which is little below the ankle, and it's gone outwards, means it's gone pronated. So wearing a compression socks might only help you hold the ankle and foot in a more snug manner, where the whole foot and ankle, even though it's pronated, the level of deformity or the level of being pronated would kind of come down to a level. But how does it help you in the long run is because it is compression, it helps your muscle activation faster, and that dynamically will help you hold the foot in a more stable manner and prevent injuries in a pronated foot.
Okay, thanks.
So,
You're
along with compression, doctor, specifically for his foot, anything can be recommended or
So, depending on the level of his flat foot, whether he needs what level of orthotics or insoles or something can help him. So normally we would start bringing in level one, level two, like 5 millimeter raise, wedges, or something like that. So maybe he gets his foot mapped with any of those orthotic guys and gets a good customized insole in his shoes would be the best thing for him, ma'am.
probably to get assessed, and along with that, see what kind of foot exercises or a
Correct.
routine of is suggested to strengthen that area, probably
Correct.
along with the compression. Yeah. Okay, we have the next question from Niranjan. Mr. Amit, does that answer your question, or do you
Yeah,
want to ask something
one
further?
one more question from you.
Okay.
Uh, uh, from where we can get these socks? I mean, Sorgen socks, which is it available in Amazon or in some outlets?
Yeah, yeah, it's available on Amazon and it's also available on our website, sorgen.co. So you could get it from either way.
Thanks.
Yeah, thank you, Mr. Amit. We next have Mr. Niranjan, who has a question how to deal with black toenails. Mr. Niranjan, if you're there, please unmute and ask your question. Mr. Niranjan, are you there?
Yeah,
Yeah, please.
yeah. Okay, I may actually recently I have started running maybe about a year or so. I find that when I'm running, my toenails are getting blackened. So, how to prevent it and how to, correct the ones which are turning black?
The ones which have turned black will take their own time to turn back to normal. But okay, you should know why they are turning black. One commonest reason is because of the friction that happens between your shoe toe box and the nail. So maybe you need half a size or a little wider fitting shoe. That's number one. Number two, that happens because of your toes clawing in your shoe instead of your foot being normal. They will claw. So when they claw, there is friction on the toenails. In fact, you like a hammer toe is what we call it. One of the reasons to have that is your calf tightness. Second thing is your long flexors, the muscles that move your toes are fatiguing faster as your mileage is progressing. So your toes are getting clawed. So you need to focus with your good physio or see a physiotherapist who will work on these releases and stretching and everything, and that will help. So maybe extrinsic factors, the shoe, and intrinsic factors will be your muscle imbalances need to be worked on.
Thank you, doctor.
Yeah, thank you, doctor. And we have Dr. Shweta. Dr. Shweta, may I please ask you to unmute?
Yes, ma'am. Yes,
Yes,
ma'am.
Dr. Shweta, please go ahead and ask your questions.
Yeah.
If you like, you can switch on your video as well.
Yeah. Okay.
Yeah, just
So yeah, I'm still in my OPD, so I thought
yes.
I'll take it from here only.
No
Yeah.
worries.
So, sir, I have a lot of questions here, but then let's follow the. I mean, I don't know how many are there in line.
No,
So
no,
my first
please go
question
ahead
is.
and ask all your questions. No
Okay, ma'am.
rush.
Thank you so
Yes.
much. That's lovely. Okay,
Yeah.
so my first one is I have left ankle pain, which is of recent origin. I spoke to my physio and my ortho. They said it's tibialis posterior stress injury. So, how to tackle with such a short time for my race? Now, TMM is just, I mean, a few days away, and I run the full. So that was one. Second was recovering from a right knee injury, which was long standing. There was some bit of chondromalacia patella over there, and which gave me a lot of pain around my runs, and which because of which I have gone low on my confidence. So how to tackle that for my TMM? Then this is not probably something to do with the ankle and the foot, but Mumbai humidity. I have a problem with the humidity in Mumbai. So how to, some special tips for the race day. Hydration and cramp-free running is what we are looking at. The fifth question is I have a slight low arch. So any precautions and tips to run TMM 20, 26, 42? And my last probably for sir is I have a mild hallux valgus for my right foot. So for the shorter runs, it's fine, but for the longer runs, it's giving me some friction on the medial aspect of the great toe, in spite of using a wide toe box shoe. So any tips, sir? So I guess that was my array of questions.
So I think the question number 1 and 5 are together because your tibialis or because of your slightly low arch foot, you're getting tibialis posterior overload and stress injury.
Right.
TMM so close, I think the best way to address it is you have to tape your medial arch. That will help you kind of hold it up, will
Okay.
offload the tibialis posterior or rather decompress the tibialis posterior and help you finish
Okay.
this 42 comfortably.
Okay.
Uh,
Okay.
in the long run for your arch, you will need some orthotics. They are like again external supports. Internally, you will have to work on your tibialis posterior strengthening with good inversion, foot intrinsics, calf stretches, your whole posterior medial calf and leg exercises. Number
Right.
two, about your uh, chondromalacia patella. It's a multifactorial thing, right? From foot valgus can cause knee overload. Again, your whole lower limb alignment, right from your hips, knees, ankle, foot needs to be evaluated. Again, you need to
Mm.
have your muscle coordination between VMO and quads versus your hamstring balances. Again, these are
Mm.
all use stroke overuse stroke abuse of your body, which you need to kind of understand, spend some time for
Mhm.
rehab, take time out. Since you want to enjoy your runs, it's important that you don't have injuries and don't have all these niggles. Otherwise what happens,
Right.
once you get into a running pattern, then
Mm-hmm.
because of these injuries, you develop secondary compensatory patterns, which are again causing overload.
Mm-hmm.
So your contour Malaysia, if it's been long standing, that means you are now loading your foot, and that could be one of your reasons for your tibialis posterior is getting stressed. So these are all interconnected biokinetically. So it's important that you address them properly, and
Mm-hmm.
things are settling down for you completely. So one by one, things will be better, and things should settle down for you
Yeah.
one by. About your hallux valgus, again, those are quite unfortunate because you can't really exercise and get them corrected.
Exactly.
You will only need some splinting or something, but again, they are all temporary. If it really bothers you, then you need some correction. But if it's only about causing medial pain and overload, you can try those silicone bunion toe protectors. They're
Mm-hmm.
easily available on Amazon. In
Mm.
your white toe box shoes, you can easily wear them and then run. You may take some
Okay.
time to get used to them, but once you get used to them, at least they will prevent those medial side friction and other things.
Right. Then I get blisters over there, and it's so
Yes,
painful, you know.
that will all settle down with a good silicone bunion protector, BUNI one.
You're right. Right. Okay.
I think one, two, three, four, five. What else was there? Hydration.
One moment. Hydration, yes, because Mumbai humidity, I can't take. That was one of the reasons I shifted my husband out of Mumbai, and we are in Nashik right now. So,
I'm a very proud Mumbaiite, Shweta. Uh, you're
understand people get this.
asking the wrong
They
person.
take it to their heart. All
Yeah,
Mumbaikars, I understand.
uh, you don't like, don't come. Simple. I'm sorry, I'm not being rude. Sorry if
I
I'm
know.
rude. Uh,
I have had this before, sir, doctor, but because Mumbaikas, even my husband, he's one of them. He's like, born and brought up in Kalyan, and he's like, "Kya ho raha hai? Kuch bhi nahi ho raha hai. Why are you behaving like this?" And I'm sweating all along. And he's like,
okay,
I said, "Look at me. I'm not pretending, you know."
okay, okay.
So
We
please,
understand.
any
But
those tips?
scientific answer to that is,
Yes, sir.
depending what your at what rate you sweat. So if you have to really, really give you a scientific answer to that, I understand it's a
Mhm.
factor in the race. So
Yeah.
there are a lot of electrolyte supplements that are there in the market, like anything like Fast and Up and blah 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 blah. You can
Yeah. Yeah.
make sure that your sweat rate and your intake rate is matched. So
Mhm.
one of your long runs, if you see how much you sweat, depending on that, you need to have that much of input again taken, and depending on
Mhm.
salt replenishment has to happen. If you take
Mhm.
care of that, I think even though you will be sweating, you
Mhm.
muscles and your body will not uh, get fatigued or face the consequences of those fluid loss or fluid imbalance or electrolyte imbalance. So that's the way you have to get it checked. But again,
Yes.
coming back, you will only understand when you do that. If you come here only for one race, then preparing for that in a drier climate would be little challenging for you, and to anticipate how
True.
much that is there happening on that day is extremely difficult. It
I
is like,
know.
me going to run in, say, like a Khardungla or something. The Khardungla half is a nightmare
Yeah.
to do. Means
True.
it is, I cannot anticipate how much of oxygen deficit or something will be there over there, because I am someone who's living on the sea.
True.
Again, it's difficult. So that is what makes this sport the real enjoyable sport, the different
Mhm.
challenges that it throws us. Why do people go to Satara to for the hill run? It's not that Nashik doesn't have hills. It's
Right.
not that Mumbai doesn't have adequate hills around it, that we have to travel 6 hours to Satara. It's a
True.
challenge that throws running in and around there. And that is
True.
what is the fun of running. And that's the fun of the marathon. Means there's
True.
no, means can't help you much. So don't worry about all of these things, okay?
Right.
Yep. Thank you. Thank you so much, sir. Thank
Any
you.
other questions, Dr. Shweta?
Just one more. Like what about hydration? Since we were talking, so many people told me elite runners. Of course, this is my 10th Mumbai full, but last 2 years I've gained a lot of weight. I'm in that age group where 40 plus and all those things. So many things are happening in my body. So along with that, somebody told me, and that's why these last year and this year are really very challenging for me health wise. I have to get this weight down. I have to come back to my shape and then start enjoying it further. So I was looking for some morale boosters. One, and second, I also because I don't know how to quit. I don't know how to quit. So I would be running, I would be finishing, I would be coming back, walking to my hotel. I know that. But so I want some morale boosters, one. And second thing, as we were speaking about hydration, I also heard that you're not supposed to have plain water at all. So is that what you also advocate, depending on, because we might just create more hyponatremia and then create more problems.
Again, it depends, madam. Plain water, not at all, is not the right statement. So you never say never, never say always types. But
Okay.
water,
Okay.
like just plain water, na? When you take
Mm-hmm.
some more, because you don't lose plain water. So taking
Mm-hmm.
water causes imbalance. So you lose some salts with your sweat, with your water,
Right.
especially
Mm-hmm.
in a humid city like Mumbai. So it's always better that you replace like versus like. So if you are losing sweat, then you need to replace salt with salt with water. It's not that
Mm-hmm.
never. So something.
Okay.
So if you're taking salt tablets, so sometimes I am sucking a tablet or I'm taking a goo gel. So with
Mm-hmm.
gel, I might take a plain water, but
Mm-hmm.
that's a concentrated electrolyte gel that I'm taking. Or
Right.
I'm sucking some tablet in my mouth.
Mm-hmm.
I take a water in between and continue my run. So again,
Okay.
your body and your losses and how you replenish and everything and everything. So it's multiple factors that go in, and those things are there.
Okay.
Right.
Okay, sir.
Okay.
Thank you so much.
I
Wish
think
you all the best.
then
Thank you.
visualizing yourself on the finish line here, and don't
So
quit
is it?
time.
Yeah, I don't know how to quit. That's the problem.
Don't learn it also, na. That's
Yeah. No, because I'm really going through a patch where, sir, I'm really not very much, high on spirits because of the weight gain and the menstrual problems and, all those things happening. So I guess this is also a phase which is going to pass away. I know that, but I still have to tide over this.
girl from
So.
Nashik talking not high in spirits. It doesn't look good, na.
Oh my God, he took it so literally. We do that after the marathon.
All the
All
best.
right. Wish you all the very best, Dr. Shweta.
Thank you so
And
much.
is there any other questions from the audience here right now? We would love to take them up. If anybody wishes to ask a question, please unmute. Else, we can close for the day on a high note by wishing everybody a fantastic run ahead for the Tata Mumbai Marathon on the 18th of January. And any questions, or shall we close for the day? No, I think we don't have any more questions, Doctor.
Yes.
Thank you so much, Dr. Abhishek Kini, for your time, for
Most,
taking
most.
care of the foot and ankle health
Ma'am,
concerns
can I
for
ask
all.
one more since
Yes,
nobody?
please, Doctor, go
Yes.
ahead.
Yes. Sir, you mentioned about the, for the bunion, no? You mentioned about the silicone things. So can I still try them? I just have a long run, meaning a 15K on next Sunday.
Yes, you can try them. See, what is the worst that will happen? You'll have to just take a pause, take out your shoe, take out your socks, remove them, and
Okay.
start running again. Throw them away.
Understood. Understood. But then just in case I'm okay with them at that run, so
Yes,
should I use them for TMM 42?
yes, you can, because you know that you're going to get the blister, right? If you can prevent the blister, it can help you finish the run better.
Right. Done. Because you don't do anything new in these days. No, so
So you don't
that's
bring
why
any new training or a new method, but this is just like an aid, na, which can be removed anytime.
done. Thank you. Thank you so much. Thank you,
You're
sir.
welcome.
Thank you so much. Thank you, Anuj. And thank you so much, Dr. Abhishek, for your time and for helping everybody with their foot and ankle concerns.
Happy to
If
help.
there are any more questions that we receive, we will put them on to you for you to answer them. Thank you so much.
Thank you for your
And
patience.
not at all.
No problem.
Doctor, are you running the TMM too?
Yes, I'm running.
Oh, wow. Wish you all the very best as well.
Yes.
So thank you, everybody, and have a great TMM 2026. See you. We have the next webinar on the 9th with Dr. Abhay Nene for your spine, and on the 13th with Dr. Miten Sheth for your knees. So do remember to tune in 8 p.m. Thank you. Thank you, Doctor. Bye-bye.